Hello, this is Julia Havlik, and this is an information architecture review of the CU Health Sciences Library's website as part of LIS 4700 Information Architecture, which is a graduate level library and information science class at the University of Denver. Thanks to our professor, Alex Martinez, my other group members, Debbie Quackenbush and Crystal Miller. Additionally, a big thank you to our contact person at the CU Health Sciences Library, Vivian Hooten. CU Health Sciences Library will be reskinning their website in September with no information architecture changes. However, after we have done an information architecture audit of this website, we have determined that some of the information architecture does need to be changed in order to improve usability and better user experience design. So what is information architecture? According to Morville and Rosenfeld, they define it in 4 different ways. Number 1, the structural design of shared information environments. 2, the combination of organization, labeling, search, and navigation systems within websites and intranets. 3, the art and science of shaping information products and experiences to support usability and findability. And 4, an emerging discipline and community of practice focused on bringing principles of design and architecture to the digital landscape. In short, IA, or information architecture, is the process of designing website content to make it easier for people to find information and complete tasks. So now that you know what information architecture is, why is it important to incorporate good information architecture practices for the new CU Health Sciences Library coming in September? The biggest reason is because it saves everyone time. Users find information more quickly and easily, so questions about routine tasks associated with the website will decrease. This in turn allows our employees more time to accomplish other tasks. We've defined our users as faculty, staff, researchers, clinicians. This includes MDs and PhD, patients, and patients' families. No usability testing was done before we did the information architecture audit. However, we did collect user data in the following ways. We reviewed chat logs of the Ask Us chat. So if you click on this Ask Us button here, this will take you to a form where users can ask questions and then librarians will answer those questions. We did this in order to find the most common questions related to how to actually find information on the website. And the most 3 common questions were how to find articles, how to find journals, and how to find a book. We also received staff feedback from snack chats, which were informal social gatherings of staff where the new site was shown. We also looked at page ranks using Google Analytics to determine if any of the links needed to be changed. And we also looked at other websites and noted features that we really liked. So one of the sites that we looked at was the Stanford Lane Medical Library website, and overall we really liked this site. Here's the home page. There are 3 things on this site that we really liked. However, we pretty much liked everything on the site, so this was only 3 things that we wanted to highlight. We really liked the specialty portals. These are portals, so if you are in cardiology, you can click on this cardiology link and it will give you resources that the library has specific to your specialty. These are sites that are custom made. I actually had an opportunity to speak with Olya Gary, who is the UX person at Stanford Lane, and she said that these pages were created by them, but they were custom. So in other words, the cardiology department wanted this content on this page here. We also liked the classes and counseling page. This is a very clean design, easy to read, easy to use. And the other page that we really liked was the journals page. So on this page, you can click on core titles, and this will show you the core titles. You can also look by letter. So let's say you wanted to find all the journals that began with the letter A. You would simply click on A, and you can see the journals that begin with A, or B, or C, or D, E, F, etc. You can also look, if you click on this by subject, this will show you the journals by subject area. So if you're interested in the AIDS, HIV journals, you can click on that, and that will show you journals within that subject area. We liked this because it was very clean and easy to use, and it made a lot of sense. The other website that we really liked was the University of Washington Health Sciences Library. This site, we really liked the How Do I functions on the left here. These are task-oriented links, and we would like to incorporate those with the most commonly asked questions that we discovered through the chat log. So how to find an article, how to find a journal, how to find a book. We also liked the Ask Us button at the very top here, which is very prominent throughout the whole site. This is a repeatable link. It's very prominent, very easy to read, and it makes the librarians extremely accessible. So if you can't find something, you can ask them. The language and the content overall on the site is very easy to read and very easy to understand as well. So before I go into our recommendations, I would like to take a look at, I want to show what the current site looks like. So let me go back to the home page. So this is the home page. The first thing that our group noticed on this site was that the black background is very distracting. The other thing too is that the dynamic content, which is right here, is very static and it doesn't rotate. Additionally, some of the content that we have seen is somewhat negative, and we feel that it would be more useful if the library showed content things that the library actually had. Like, for instance, this is a great example. Free classes at the library. That's a very good example. It's very useful to the users. The other thing that we didn't like initially just on the home page is the language is very unclear. So for instance, this link right here, this links to Google Scholar, but just having Scholar on the tab is very unclear. I didn't really know what that was when I first looked at it myself. I had to actually click on it. Oh, it's Google Scholar. So I'm going to show our wireframe now. Let me go back. This is a wireframe that we created. This is our home page. This is the dynamic content that we were talking about that would rotate here. This is the How Do I button, featured links, top resources. Also, if you'll notice, the tab here that says Scholar has now been changed to Google Scholar. The Ask Us button and the Tell Us button are now here. The hours are also much smaller, so if you look at that page, the hours take up quite a bit of space. And that was one of the things that we wanted to make a recommendation of, is make those hours a little bit smaller so that you can add other content that's more useful. So we have today's hours are 8 to 5, so this would rotate depending on what day of the week it is. But if you wanted to see the full week's hours, you could click on Detailed Hours and it would show you a list of all the detailed hours. Who are you? These are user groups. So if you're a student, you can click here and find resources for students, faculty, researchers, clinicians, public, etc. We are cautioning them against using this. This is something that they wanted us to incorporate, which we think is very useful. However, we've noticed in a lot of our research readings that this is not as useful as it could be. And matter of fact, when I spoke with Olia Gary at the Stanford Lane, she mentioned that they tried doing this approach, but it didn't work very well, and so they did the specialty portals instead. So on the second page here, these are those top resources. One of the things that we did was when we looked at our Google Analytics was we noticed that some of the links that are very heavily used, for instance, all databases, were on the very bottom. So if you look at the current site, all databases is at the very, very bottom of this top resources link, and it is the most clicked link. So we reordered some of those based on those Google Analytics. We did the same thing with the featured links. And here are the how do I links. So how do I find an article? How do I find a journal? How do I find a book? How do I find an ebook? And how do I find the FAQs? So it gets you straight to the FAQ page. And here's the classes and events. We're highlighting that. These are accordion menus, and these again are reordered links based on Google Analytics. This is the consultation page that we are recommending. Before I go through what we're recommending, I want to show what the current page looks like. So from the home page, if you go to Get Help, Ask Us, this will then take you to a similar page that has where you can ask a question to a librarian, you can email a librarian, you can also consult a librarian. You can make an appointment directly here. These are all the different services that they offer. So let's just click on consultations. Consult a librarian. Again, they're talking about all the different services that are used right here. However, if you want to learn more details, you can click on this See Full Details. However, when you click on this page, it does take you to information about these different consultation services, but I can't actually make a consultation on this page. I have to go back to that original page and make an appointment here. And here's the research consultation page. This is a very complicated process. There seems to be that users have to click around several times before they get to this page. So what we're recommending is a one-stop page, or two-stop page, excuse me. So if users click on Ask Us, they will be taken to this page. So again, it has that Ask a Librarian chat box, email a librarian, consult a librarian. Top, very easy to see. And then if you click here, which on this wireframe you actually can't click here, but if you, let me go to the next page here. If you click on that button, this will then take you to this page. This is the consultation services page with additional information about what the consultation service is, and also you can go to request a consultation form here. If you still have questions, you can ask a librarian here, and you can also return to the top as well. If you scroll down, you'll see. We also included the form at the very bottom of this page. Now obviously this content will change based on the content writers would prefer have written. This is the databases page that we would like to have changed. So currently the database page is all databases. One of the things that we're recommending is that these numbers here need to go away. They are confusing, and they basically denote how many databases are within each letter, but it seems very cluttered. So what we're recommending is having something like this, just like the Stanford Lane. So you have A by title A through Z, by subject. So if you click on that, then it will show you the subject listing. Show all, so you could look at all of the databases, and then it takes you also into the library catalog. So very, very similar to the Stanford Lane. Same thing here by subject. The other thing that I mentioned a little bit earlier is the dynamic content. Should be much more useful and not as negative. What we'd like to see is something more useful to the user. So, did you know you can take a library class? Did you know, that we have certain resources for your specialty? That sort of thing. We also would very much like to see responsive design done on the new site. So I'll show you what that means. When you scroll this over, this does not render well. So this means that this site does not render very well on mobile devices. So we'd like to see responsive design incorporated in the new site so that it does render nicely on an iPhone or an Android or tablet. There are also several broken links within the site that do need to be fixed. And our final recommendation is that usability testing should be done before the site is launched. That could be informal, so that could simply be walking around the library and asking people if they have 5 minutes to take a look at some features and which features they like best. If there are individuals who would be more willing to spend more time with whoever's doing the usability testing, they could go to that person's office and speak with them for 30 minutes and have them complete tasks like, how do I find a journal? How do I find an article? Or formal usability testing could be done, and that could be a talk aloud protocol or A/B testing. So in conclusion, while the original project was just to reskin the site with no information architecture changes, we are recommending making some changes which will improve overall user experience and usability. Incorporating good information architecture practices will save everyone time. Thank you very much.